So hernia, once we have been always diagnosed with hernia, we always have multiple questions in our mind, whether this hernia will be treated with medicines or we have to go for surgery or not. So if at all medicines, what sort of medicines we can take? Our herbal medicines good, Ayurveda, Unani, Siddha, so many medications, and the internet is full of suggestions giving few tips for hernia treatment. Are they really going to work? Let's see one by one. And also many centers have been advising me to have a normal belt for hernias. Hernia belts have been widely prevalent all over the world, and we have been advised so much about it. So let's see the advantages and the disadvantages of using a belt. I'm Dr. Ashok, Sri Chakra Hospital. And please leave your valuable comments below so that we'll discuss further about the pros and cons in near future. And do subscribe our channel as well. Hernias. What exactly happens in a hernia? Just we'll assume ourselves as our abdomen as a very hard cylinder, and all the contents are of small intestine, liver, spleen, pancreas, and urinary bladder, kidneys, everything has been enclosed within a hard cylinder made of steel. The steel mimics our abdominal musculature. So if there is a weak spot in that steel, and through that weak spot, some organs like small intestine or large intestine, it just protrudes out of that abdominal musculature, and it stays underneath the skin. So that this is called hernia, and the bulge happens. We always usually feel that bulge underneath the skin whenever we cough or sneeze or strain during passing motion. Whatever the acts we do to increase the intra-abdominal pressure, this bulge it usually becomes more, and it always disappears when we lie down and we make ourselves very comfortable. So this is the anatomy and the pathophysiology of hernia. So in this we'll see where exactly these medications acts. Usually what we have been using for medications, for when we use the medications for having a fever, the paracetamol or acetaminophen, these tablets acts exactly on the where the cellular level, and it will bring down the temperature. The painkillers act directly on the phosphodiesterase or whatever the painkiller signals producing organs, and it will decrease the pain sensitive areas. Likewise, the antibiotics, it will always acts on the microorganisms and starts killing it. The anti-cancer drugs also, it will directly goes and targets the tumor cells and then start killing the cells. Likewise, so many targeted chemotherapies, so many like sugar medicines, anti-diabetic medicines also acts on the insulin receptors, and then it will bring down the sugar levels. The hypertensive medicines, it will act on the smooth muscles. Everything, if we see all these medications, it will always have will have a single common denominator. It acts on the cellular level, it acts on the cells, it acts on the receptors, it acts on the hormones, like that. It is always a microcellular level. So coming back to the hernia, what exactly happens? It is nowhere related to this microcellular levels. It is the small defect in the abdominal musculature which causes the laxity of the hard muscle wall. So these medicines, it has nothing to do with this defect. So once the defect is there, whatever the defect, we can replace it with the likewise hard material over it. We call it as a hernia mesh. So this mesh, whether it is a laparoscopy or a open surgery, we always keep that mesh over the defect and then close the defect and make it more strength than before, so that whatever the contents of the abdomen, it doesn't come out through that defect. So this is the best treatment option for hernia surgeries. So this build, what happens is, when there is a defect, when the contents have come out of the defect, this build usually makes the pushes the contents from outside, and then it pushes all the contents inside, and then it will close the defect. This is the action of the build, so that it doesn't involve in the clearing up of hernia. It doesn't prevent you from any of the complication. It just pushes the content inside and then prevents it from coming out. So this belt, whom it will be very beneficial is the very old people who can't, who are waiting for surgery. These type of people can use the belt. So what are the disadvantage of belt is, when the hernia has already come out of a defect, and if it is staying below the skin, and if we are pushing it from the outside from a strong belt, the contents, the small intestine gets stuck in between the muscle wall and the belt, and then it gets strangulated. So this is a very dangerous situation. In that situation, we'll have a lot of pain, and we ourselves will be complicating the normal scenario of hernias. So, using a belt, you should be super intelligent and then always use it in a right manner so that you can postpone the surgical intervention, and the belt won't cure the hernias, but it will always be useful to postpone the surgical intervention and the complications of hernia, provided it is being used in a very wise and very technically sound manner. Keep in mind, surgery is the only option for hernia, and in the era of laparoscopy, it is a very fast and fascinating prosthetic measures have been invented, and it takes it's a daycare surgery, and there won't be any blood loss, no scar, quick recovery in your own home at your own bed in a very faster manner. So, hope this video was very useful to you. Wish you a happy living.